St. Charles is trying to keep up with a sudden rise in children sick with respiratory illness. Bola Badabo looked into how serious this situation is. Bola?
Lee, RSV is coming sooner than usual and causes highly contagious cold-like symptoms. I spoke with a pediatrician who told me it generally affects infants to 1-year-olds. St. Charles is seeing a spike in children with respiratory illness.
It's particularly severe in infants, although it can be really severe in the elderly as well.
With people wearing masks and social distancing, cases were lower the last couple of years. What's unusual this year is that it typically peaks in January or February instead of now.
It's definitely higher levels than I think I've ever seen.
In September and October of this year, St. Charles saw 443 children compared to the 368 children seen during the same time period in 2021 for flu-like symptoms. Dr. Suzanne Mendez explains the virus comes with a lot of inflammation and mucus in the lungs, making it difficult for kids.
If you have tiny lungs and tiny airways, it can just clog up those airways more. And so the littlest ones have the hardest time with breathing.
Which means the hospital provides breathing support to the sick infants frequently.
Unfortunately, there's not a vaccine for preventing RSV at this point.
However, babies born prematurely can get monthly injections to lessen the impact of RSV, which St. Charles may start giving out to the highest risk babies now.
The most severe cases are usually in the anywhere from newborn to 1-year age group. Although since the 2-year-olds and 3-year-olds didn't have as much exposure to RSV in the last year or two, that we're also seeing that age group coming in.
On Monday night, the pediatric unit at St. Charles Bend was full. It also had to transfer more children to Portland than normal. The health system is working on a surge plan to accommodate the number of kids coming in. Families can take preventative measures by practicing good hand hygiene, keeping kids hydrated, and limiting infant exposure. Lee?